Sound of Metal is an American drama film that won an Oscar for Best Sound in 2021. It was also nominated for 5 other Oscars. This video will discuss the tinnitus and hearing loss that the main character went through, his journey from being a metal rock musician into having cochlear implants to treat deafness. Hey everyone, my name is Ben Thompson, Doctor of Audiology. Hearing loss and tinnitus are a very personal experience because they are invisible conditions. It's hard for someone who hasn't experienced ringing in the ears or hearing loss to really understand what it's like. Today we're going to review different video clips from Sound of Metal, and I will give my professional Doctor of Audiology perspective on if these scenes are accurate and what it means giving the insider knowledge. In Sound of Metal, metal drummer Ruben begins to lose his hearing. When a doctor tells him that his condition will worsen, he thinks his career in life is over. His girlfriend Lou checks the former addict Ruben into a rehab for the deaf, hoping it will prevent a relapse and help him adapt to his new life. After being welcomed and accepted just as he is, Ruben must choose between his new normal and the life he once knew. The true Sound of Metal is the distortion in his head caused by cochlear implants after he decided to get a cochlear implant surgery. All right, he's really playing the drums here, and what we know is that loud noise exposure is a common cause of hearing loss or tinnitus. Now, the significance here is that even though Ruben's playing really loud music, it's uncommon for loud noise exposure alone to bring someone to a complete deafness. And what we see here in this movie is that Ruben's hearing gets to the point where it's completely lost and he has none left. When that happens, it's not from loud noise exposure alone. There's other kinds of conditions that can create sudden hearing loss, but loud noise is a factor here, and that's what the movie was based off of.
Yeah, I mean, I can put him on, but he won't be able to hear you. Okay. Talk to him. Talk to him.
Hey Hector, what's going on, man? It's Ruben. I'd say it's good to hear your voice, but I can't hear a fucking word you're saying right now, so this is completely pointless. Lou wanted me to call you because I had a cigarette. You know, not
at this
great,
point,
not
Ruben
ideal,
can't hear at all. Both of his
considering
ears
the
are completely
circumstances, which are
deaf.
pretty fucked up. You know, understandable. I'd say understandable for everyone apart from Lou, it seems.
Yeah, what we're seeing here in this clip is that Ruben and his girlfriend are just out of touch with the gravity of the situation here, that she's asking him to speak to his friend on the phone. He does speak to his friend on the phone, but obviously he can't hear anything in return. So for those who are just new to the deaf community or to really understand what a severe hearing loss is, they might hand someone the phone and forget that they can't hear anything unless they're reading lips or unless they have a hearing aid or another device like a cochlear implant.
You play music, right?
No.
All right, so
No, not
Ruben's
anymore.
in the deaf community.
Until I get the implant.
Implant.
Talking to the organizer.
Yeah, sorry. You know about these implants they got now? It's like they have implants.
I know, yes.
Talking about cochlear implants,
Expensive.
Yeah, thank you.
which he
Yes,
says is
yeah.
very expensive. Now, usually it's covered by insurance. Let's talk about that in a moment.
You should understand that this is a deaf community. Not just my program, but we're part of a larger...
Here we have a
community.
voice-to-text
program,
transcoder, and that kind of technology is really helpful. So a few things there. For Ruben, he does have a severe level of hearing loss, and what that means is that if hearing aids are not enough, if hearing aids, when they're used, do not provide enough benefit, then the ear, nose, and throat surgeon and the audiologist can consider cochlear implants either on just one ear or on both ears potentially. And Ruben has what's considered a sudden hearing loss. It's relatively quick. So that means the neurons and the nerve activity is good and healthy. So getting cochlear implants would make sense as an option to restore speech understanding. But cochlear implants are not great for music Neither are hearing aids really. So both of those conditions are hard to bring back good hearing of music. But here we see Ruben engaging with the deaf community at the center that he's living at and just talking about the options of considering cochlear implant treatment or living life using sign language and being deaf. And that's a decision that for those who are living with a severe hearing loss, they may have to make, and it's often a really tough decision.
Are you ready?
All right, here we have Ruben in the audiologist clinic wearing cochlear implants, and this is what we call an activation. So the devices are about to be activated through the software.
Here we go.
He's already had the surgery. He has the implants inside of his head. He has these pieces on the outside of his head that are connected to the inside of his inner ear, the cochlea. He's starting to hear the speech, and this is a common reaction of, wow, I can hear speech again, but it's not clear. And he's asking the audiologist to speak again, and he's trying to understand about the speech quality. It's obvious that it doesn't sound that clear to him. The audiologist is making some adjustments through the computer, asking him how it sounds now. And he says it sounds bad. So what we have there is Ruben, severe deafness, both ears, elected to get a cochlear implant surgery in both ears. And after a career being a musician playing really loud music, suddenly he can't perceive speech. He can't really hear people talking, and music quality is completely gone. Being a drummer, I would say he actually has the closest chance to continue drumming because they use the vibrations as opposed to other instruments, which are more challenging. Are cochlear implants really expensive, as was mentioned previously in the other clip? They can be, but usually cochlear implant will be covered by insurance. So hopefully Ruben would be able to get insurance. And, that wasn't really mentioned too much in the movie. Additionally, during that activation of a cochlear implant, I remember being at a conference once, and there was an ear, nose, and throat doctor who was a surgeon who was sharing some audio files of one of his patients who is a sound engineer. And they played different sound samples of what a sentence of speech would sound like at the day of the activation, a month later, and then 3 or 6 months later after that. And what we saw is that the brain's ability to change and the neuroplasticity here allowed the sound quality to get much better over time. So even though it sounded horrible on day one for Ruben in this clip, it would likely sound a lot better. And to be able to understand speech, which is the audio files that were played there suggested that he could hear sounds and repeat words. That's actually really good for day one of getting cochlear implant evaluation. Cochlear implants are not my specialty. I focus on tinnitus, as well as hearing loss. And in this movie, it's important to share that really that first clip of Ruben playing loud music, he had tinnitus, he had ringing in the ears, and then he had this increase in hearing loss up to a severe level. I've worked at a cochlear implant center in San Francisco, California, and we saw cases like Ruben that had more complex, sudden kinds of hearing losses, as well as different kinds of severe hearing loss. It's important to know that we would always test to see if hearing aids were good enough, and if hearing aids weren't good enough, then cochlear implants would be the next choice. Overall, I'm happy that they're touching on these issues, and I think the movie was overall a really good movie and gave a good representation to the deaf community as well. It's important to remember that some people simply choose to live in the deaf community and never pursue cochlear implants, so that's a completely fair choice as well. And I'm happy to share this video. If you're new here, make sure to subscribe by finding that button below. My name is Dr. Ben Thompson, audiologist and founder of Treble Health. Check out this next video here and learn more about what we do for hearing loss or tinnitus. I'll have some other good video recommendations coming up next. Bye-bye. Thank you for watching today's video with Treble Health. Check out our next video by clicking the button on this screen or another recommended video. And if you're not already, make sure to subscribe to our YouTube channel. Thanks so much. See you on the next video.